Hello and welcome to Health Matters, coming to you on Channels Television. Thank you for joining us. I am Mary Alale Yusuf. The normal human heart consists of 4 chambers. 2 upper chambers called the right and left atria, which receive blood, and the lower chambers, the left and right ventricles, which pump blood out of the heart. Typically, passages between the different chambers close at birth, but sometimes the closing is not properly effected, and blood from one chamber flows into another. For example, blood from the left atrium flows into the right atrium. This phenomenon can go on to lower quality of life. According to the Children's Heart Foundation, almost 1 out of every 100 children is born with a congenital heart defect. About 25% of this number will need surgical intervention. My guest on today's show is Dr. Tosin Majekodunmi. Dr. Majekodunmi is an interventional cardiologist with special interests in adult and pediatric congenital and structural heart disease. You're welcome to the show.
Thank you very much. Thanks for having me.
Okay, so that's just a snapshot, of what happens, heart defects, blood flowing from one atrium to the other. But could you tell us some of the conditions that you've had to repair? Just let's know their names.
Okay, so some of the conditions that we commonly see, we can see them in children and we can also see them in adults. For example, you described very nicely a hole or a defect between the left atrium and the right atrium. We call that an atrial septal defect. Okay. Any of your people who are watching may think of that or may have heard of that as an ASD, for example.
Or just a hole in the heart.
Or just a hole in the heart.
That's what people usually call it.
That's correct. That's exactly right. And then we also have a hole between the 2 lower chambers, which you again described very well, between the left and the right ventricle, which is also called a ventricular septal defect, VSD, okay, but also called a hole in the heart.
Okay, so the holes can be in different places.
That's correct.
Okay. Now, is there a difference between heart disease and cardiovascular disease, or are they just all married together?
People do tend to marry them together. There is a slight difference. So if you say heart disease, that usually specifically applies just to the heart alone. When we say cardiovascular disease,
vessels are involved.
Exactly. So the extra vessels are involved, the vessels all around the body as well.
Okay. This would be the obvious question. Why does anybody come up with a heart defect? Is it something that goes wrong during pregnancy or what? So
heart defects are usually just an error that occurs naturally when the baby is being formed inside the mother's womb. Okay. People sometimes, there are some drugs that we know can predispose to heart defects, and usually that is why when ladies are about to get pregnant, we're very careful in advising them, if they already have a medical condition, what drugs they can safely take and what drugs they should no longer take. But generally, the most common cause is just a mistake in the way in which the baby is formed, as the baby is formed inside the mother's womb. And as you correctly identified, it's actually not that rare. It occurs in about 1 in every 100 pregnancies, with, as you say, 25% going on to need some form of intervention. That's correct.
Now, is this something that always happens in childhood, or do you have like late onset heart defect?
Good question. So most of the time, it is something that happens in childhood. Occasionally, we have conditions, for example, in an adult who was born with a normal heart and then is living his life and then unfortunately may suffer a heart attack. And when you suffer a heart attack, occasionally a complication of that heart attack can lead to the formation of a hole, usually between the 2 bottom chambers, the ventricular septal defect we talked about earlier. Those can sometimes form as a result of something that happens later on in life.
Okay, now, if somebody has this kind of structural defect, maybe a hole in the upper chambers or a hole in the lower chambers, does such a person come up with symptoms?
It depends on the size of the hole. So some people...
Maybe like in the 25%.
Exactly. So in that 25%. So out of the 1 in 100, only about a quarter of them will have a hole of sufficient size that it will lead to symptoms. Very tiny holes we occasionally see, and actually the good news for those is that most of the time they don't need anything to be done.
Oh, that's
it's very interesting to see, and the doctor gets excited about seeing it, but actually the patient doesn't need to have any form of surgery or usually have to take any serious precautions. But in the other group of patients, they usually will have symptoms. If it's a very big hole, They'll have symptoms right in childhood itself, from a very young age. As a baby, the mother may notice that the baby is not feeding very well, or is having difficulty feeding, getting a lot of infections, or is breathless, for example. If it's a smaller hole, although still sizable, it can present in adulthood. So the commonest time usually is in ladies when they get pregnant, because there's an increased load on the heart during pregnancy. That hole, the effect of that hole becomes magnified, and then they become breathless, and they may get palpitations or chest pain, and that is when now it becomes detected.
Are you saying that a person goes through life with a hole in the heart that size from childhood, and it's not discovered until maybe she gets pregnant?
Correct. That's
wow.
Exactly right.
Wow. Okay, before we go into all of that, there's an interesting way you do your operations. Normally, you'd break into the heart, sorry for the word break, open the heart, yes, and then do a procedure. But I understand yours is a bit different. Please take us through it.
No problem. So, traditionally when...
okay, the image is there now.
Oh, excellent. So traditionally when these holes are discovered, what used to happen 40, 50 years ago, most of the time, would be that you would have to have surgery, and surgery would consist of coming into the hospital, being put to sleep,
yes,
the chest being opened up, then you have to connect the patient up to a heart and lung bypass machine, then the heart is stopped, it's arrested, okay, and then we open up the heart, you close the defect, close up the heart, restart the heart again, close the chest, and then the patient now is woken up. Usually, typically that process the patient spends about 5 to 7 days in hospital if there are no complications before they go home. And it works very well. It's a good operation. They'll be doing it for a long time and yielded good results. Interestingly, the reason why we started doing it slightly differently as interventional cardiologists was a young girl, I think in Canada, was diagnosed with this at the age of 17, was offered surgery, and she refused because she did not want a scar.
Just because she didn't want a scar?
Just because she didn't want a scar. And so the doctors had to go and think about a different way to try and deal with this. And that's when they came up with the what we call the percutaneous method, where you just go through a little incision in the leg, and okay, you take a tube all the way up to the heart, and then you find where the hole is, and you introduce a device into that hole, and you close it up very well.
That's very interesting. You could take a tube through the leg,
that's correct,
into the heart.
That's right.
And how do you find your way there when you can't actually see what's going on?
Excellent question. So what we do is we have to do it in a special room called the cardiac catheterization laboratory, which has x-rays, and it's the use of the x-rays that we can see where our tubes are going, so we make sure they don't go to the wrong place and they're directed only to the right place. We also, when we are doing these kinds of procedures, use a special type of ultrasound called a transesophageal echo to look at the hole in great detail, so that when we are putting our device, we make sure we use the right size of the device. We don't want it to be too small, and we don't want it to be too large. So
I can see some screens there in that picture. Yes. Are those the x-rays?
That's the room in which we do the procedure. That's the cardiac catheterization laboratory. And in that picture that you're seeing, that you're showing your viewers, I'm actually performing a procedure called the pulmonary valvuloplasty. Okay. This is a procedure where a young lady who had was born with a very tight valve and did not allow blood to flow sufficiently to the lungs, had to have that balloon so that the blood would be able to flow a bit more freely. And for her, it was very important, because with the valve that narrow, it would have been dangerous for her to get pregnant. And she would have had, it was likely that she would have had a problem if she had gotten pregnant and at the time of delivery. But now that we've done this procedure for her, she's now doing much better, and it is now going to be safe for her to get pregnant and go on and have children and lead essentially a normal life.
Okay, so essentially the problem with the pregnancy is the load on the heart.
Correct. And if you have an increased load on the heart, when the valve is narrow, even most of your viewers, I think, will know when they are pregnant, most women do tend to struggle a little bit with some breathlessness and how difficult it can be, talk less of the labor when it comes time to delivery. If the valve is very narrow and hardly any blood is getting to the lungs, you can imagine how much more difficult it becomes when under those circumstances your heart is now trying to struggle against this narrowing. So it can be very dangerous if they get pregnant or at the time of delivery. But by opening up the valve to make it very near to be normal, like in most of what your viewers experience, then it becomes safe for her to have a normal life, have a pregnancy and all those kind of things.
Okay, let's talk about the hole in the heart,
okay,
the way we lay people call it. what do you use to cover up that hole?
Okay. So we have a special device. So special devices have been invented that they are made of a special metal called nitinol, and the metal is described as having memory. So if you bend the metal into a certain shape, when you release the pressure on the metal, it springs back to form its preformed shape. And this device has two discs. One sits on one side of the hole, and the other sits on the other side of the hole. It's called like an umbrella device with two bits to it. So you'll see the hole, and I think you probably have some images.
Yeah, we have some images, some moving images there of the heart.
Exactly. One could see what happens when you see the hole, and you see one disc of the device on one side of the hole, and you see one disc of the device on the other side of the hole. Okay. And we introduce that device through that tube in the leg. And it's a procedure that we do in the cardiac catheterization laboratory. The patient comes in on that day. We do it that day, and the patient is woken up the same day, walking around the same day, and goes home the following day.
Some people may be concerned that in passing that tube through the leg, it's not just one surface you're breaking through. Do you have many surfaces you have to seal up at the end of that procedure?
Not particularly. Always, because the blood vessel that we get into to introduce the tube up to the heart is actually not far from the surface of the skin. Okay. So all you do is go through the surface of the skin, and you usually have to go just about 1 centimeter or 2 to get into the blood vessel.
Okay.